Welcome to True Health Tuesday, and the truth will set you free. Unless you're Joseph Mercola, who's just been wiped out and he's on his way to a FEMA camp. Okay, yeah, largest natural health website. You got to see it. Today we're talking about pain and solutions. Now, it's important because when you're looking at pain, pain is a clue that there's a problem. Just to treat pain non-specifically with a medication is foolishness. But that's what our society has dropped into. So I'm going to give practical solutions, stuff that you can do right now. But if you're a patient of mine, you already know those solutions. If you're not, talk to your chiropractor or qualified healthcare professional. When I say qualified healthcare professional, that doesn't mean the standard MD, because they're going to look at symptom drug therapy. That's their circumstance. And that's frankly, that's not that smart. The censored information, we're going to go over things that we can't talk about. I mean, Joseph Mercola just had his site wiped clean because you can't talk about a couple of different things, and we're like skirting the edge of what you can talk about. We're going to have our censored portion on the Dr. B VIP site. If you're on the Dr. B VIP site already, you will see this uninterrupted. If you're getting this from YouTube, we have stuff that I think will get by the censors and the stuff that I'm pretty darn sure the censors would send me off to the FEMA camp when they open up. I think they're going to open up in September. But hopefully this site will be going for a while. Extreme Health Academy, get on there because it's also going to be put on there in their archives, but they also have a number of different forums and people that have gone through health challenges. It's amazing. But let's get into pain, okay? Now, I'm not talking about watching CNN and seeing your world crushed. That's an emotional pain. But let's look at the other pain. No, that was sarcasm. Sorry, just checking. So what happens now? It's interesting because when I talk to patients, I'll say, look, if I step on your foot, what happens to your heart rate? You know what patients will say? Well, I don't know. I'm not a doctor. Okay, then I make it more dramatic. Okay, if I take a hammer and crush your toe, do you think your heart rate will go up? Okay, and I'm nodding so people get an agreement. Yes. But this is every kind of pain, physical, chemical, or emotional stress. Your body responds like you're being chased by a tiger. So heart rate elevates, pupils dilate, blood pressure goes up, blood supply to the gut shuts down, stress hormones are released, thyroid is suppressed, adrenals go up. Blood becomes more acidic. That means it's harder to build healthy bones. Increased cholesterol. Why? Because cholesterol is the precursor to cortisol, which is used for one of the stress hormones. Also, cholesterol is the precursor to adrenaline or noradrenaline or epinephrine, norepinephrine. It's everything. Lowers ability to concentrate or focus. What do you think the ADD people are like? Do you think they're in a nice, calm, relaxed state, or do you think they're in a stressed state? This is not, I know you should give ADD's prescription meth. I know, because it has a calming effect on children. Of course, it does have long-term damaging effects on the brain and kidneys and liver, but let's not think long-term. Chronic pain literally shrinks your brain. It damages your brain. So if you're in chronic pain and you're going to a doctor that's continually giving you medications to lower your pain without addressing the cause, he is causing you harm. We have a 1-in-1 ratio of dementia. There's so many people in this country that are losing their mind. And dementia is not a normal part of aging. I just heard this one article. Autism is just a new normal. Okay, right. Okay, dementia is not a new normal. No, this is a dysfunction of the brain responding to a chronic state of stress. Pain duration of 6 months ages your brain the equivalent of 10 to 20 years. And that is, and you might say, well, I'm not in pain, I take morphine. Okay, your body is still in pain. You just have lost the awareness. Now, the brain shrinks about 1.3 centimeters cubed for every year of chronic back pain. The greater the atrophy of the brain, the more irreversible and less responsive to therapy. It's important to emphasize the importance of treating pain early and aggressively, or it will destroy your brain. So destroying your brain, that is bad. Yes? Okay, good. So what happens under physical, chemical, or emotional stress, your body goes into this fight or flight state, and this is the automatic nervous system. One part rests and regenerates your body. The other part is for survival mode. When you're in survival mode, your blood supply to the gut shuts down. Where does it go? It goes to the arms and legs. That's where the blood goes, so you can run away from danger. So that means your body's processing nutrients is diminished. That means if I'm standing on your foot, your body's ability to digest, rest, and repair is limited. These are literally the solutions. Oh, okay, sorry. I have a clothing malfunction. Okay, is that better? Okay, I'm not going to say who clipped my microphone on, Victor. I had it clipped up here. I thought it was okay. Okay, so, but it does look better down here. He is the professional. Okay, so let's look at the solutions. There's only 3 stressors you got to fix. You got to fix physical, chemical, and emotional stressors. So in order to fix it, you have to identify it, okay, quantify it, and correct it, and then show that you've corrected it. Does that make sense? So any doctor in the world that's identifying you with the stress responses of high blood pressure, high cholesterol, type 2 diabetes, or inflammatory bowel disorder, if they're treating that with a medication without identifying the cause, that is not good care. I mean, it's standard of care now for sure, but that's not good long term. Physical stressors, how do you identify it? Well, it's stress x-ray, static x-ray would be good, heart rate variability study, you can do nerve scans, you can do a full body thermography, and these things are all identifying physical stressors. How do you correct it? You correct it by fixing the problem. If you have loss of curve in the neck, forward head carriage, some type of trauma, you go to a corrective chiropractor that can correct it, or some other profession. Corrective chiropractic is the only one I know that does pre and post x-rays to document the changes. Exercise, deep breathing, all of those are ways that you can correct the physical stressors. How do you identify and correct the chemical stressors? You can do a live blood cell analysis. You can do, again, full body thermography, which will identify lymph flow and certain areas of increased metabolic response. And then you do detoxing, changing sleep patterns, and then looking at the emotional, okay? What other type of stressors are there? Emotional, neurolinguistic programming, eye movement desensitization response. There's a lot of ways that you could reprogram that subconscious. But underlying, you're looking at exercising, breathing. Why exercising? Well, movement triggers that cerebellum in the back, and the cerebellum controls the frontal lobe, and this is anxiety, stress, depression, schizophrenia, it's everything. So incorrect movement causes incorrect stimulation. Correct movement causes correct stimulation. I mean, it's basic. And then you got the gut-brain connection. Do you think that maybe a healthy gut flora and good gut functions, knowing that it's a gut-brain connection, that might have to do with emotional stress? Yes. I mean, it just makes common sense. But look at the chemical stressors. Are medications a chemical stressor? Well, I don't know. Try taking 1 or 2 medications, okay? The average person over 60 is taking 12 prescriptions. Now, if you know what a cholesterol and a blood pressure medication, and I just did a drug search for one of our patients. She's taking 2 medications for type 2 diabetes. She's taking 1 medication for cholesterol, 2 medications for blood pressure, and 1 medication for sleep, and and 2 medications for indigestion. I know you're thinking 6 medications. Why would that upset your stomach? Okay. And I asked her, I said, okay, you're taking 11 medications a day. Are these making you healthier or sicker? What do you think she said? I don't know. I'm not a doctor. Okay. If you and me are stuck on a desert island and you have no access to pharmaceuticals, we only have fresh fruit, fresh water, fresh vegetables, Would your health improve or decline? What did she say? It would improve. And 100% of people say it would improve. Okay, so they know. And then I said, are these medications making you healthier or sicker? I don't know. I'm not a doctor. Okay, I'm going to give all of these medications that you take in one day to one of my assistants, one of my team members. And I picked one of the smallest frame, 25-year-old gal. She's a sweetheart. Would that make her healthier or sicker?
Sicker.
Okay, good. Yeah. She said she didn't know. Okay. So let's get into this. Okay, just know that if you're taking a medication to cover up a symptom without looking at the cause, that's not smart. Now, before you do these exercises, first find the problem. That means you've got to get an x-ray, you've got to get a qualified doc to look at it, to find it, assess it, nerve scans, whatever you do. You got neck pain? Should you take a medication without finding the problem? No or no? I know, I'm used to saying yes or yes. This, I'm going to give you no choice here. If you're taking a drug without finding the problem, you are not doing good things for your body. In fact, in Journal of Head and Face Pain, medications can give you a headache. It's called medication overuse headache. So if you have a headache and you know 97% of all headaches are coming from the neck, and you're taking a medication to cover up the pain without addressing the neck, is that dumb or dumb? Okay, see, I didn't say stupid. Okay, a new study, opioids. I mean, the opioid crisis is still going on despite the insanity that's out there. If you're taking opioids for more than 5 days, it increases your sensitization. Plus, they're addictive. That means if you take a medication beyond 5 days that's an opioid, it increases your pain. We found the treatment was contributing to the problem. And I got patients that are taking opioids for 5 and 10 years. Does anybody in this world have an opioid deficiency syndrome? No, no one's suffering the deficiency of opioids. No? Okay, so what do you do to find the problem? You take an x-ray, a scan, assess it, find the problem, and correct it. Or you can do this. This is very simple exercises. Okay, but again, you got to talk to your chiropractor first. If you've had multiple surgeries, you need stress x-rays on that to see if this is safe. Okay, but this is the simplest thing in the world. If you have a table and you put your elbows on that table and lift up, not back, just up, and deep breathe. Deep breathing increases your intrathecal pressure, forces fluid in those discs, and the discs are 70% fluid, and it's literally going to start to restore the curve. I always like getting a stress x-ray first to see if the joints are still viable, because most people have some type of trauma or degeneration, typically at C5, C6. It makes sense. This is a nice static exercise. You can have a towel over your neck and only pull down with about 2 pounds of pressure. You don't need to pull your hands out here, just 2 pounds of pressure pulling straight down, and it's a gentle lift up, not back, gentle lift up. Had a patient that said, I was doing this exercise and it hurt my neck. And I said, okay, cool. How are you doing it? I do it just the way you told me, just like this. And I'm going, holy moly. Okay, so, it's not what you say, it's what people hear. Dear, that's not what I meant to show you. So you pull down with the 2 pounds of pressure. 2 pounds. Guys don't know what 2 pounds is, because all have their hands and they're pulling down with about 20 pounds, because if a little good, a lot is better. Yeah, see, yeah, I know. Yeah. Okay, 2 pounds of pressure and you look up and then straight ahead. Up and straight ahead, up and straight ahead, not back. You do about 100, 150 of those a day, okay? Because most people are looking down. This helps. Thoracic pain. Now, before you correct the pain, you have to find the problem. Yeah, that was good. Okay, that just makes sense. So you got to find it with something. Now, with your head forward, for every 1 inch that heads forward, the pressure on the disc double. So that means these muscles are going to fire off to correct it. That's why when you're looking at these people here with the rounding over the shoulders, there's some type of physical trauma that caused that. It's not normal aging. I can show you this one guy, 92 years old, I think he came in. He's got good posture. His legs aren't working real well, but he's sitting straight up in the chair, no rounded over body posture. Cool guy. So you have to find the problem. Plus the muscles run down either side of the spine. They're not under conscious control, so you got to actually find it. Now, what happens when people find a spasm muscle? What does the medical world do? They'll give you a central nervous system toxin that attacks the base of the brain to relax the muscles. Sorry, Victor, I got to go back to this first one. Okay, now, are the muscles, is the body smart or smart? Okay, good, good. I'm really making it simple now because I've talked to a person who's been taking a bunch of drugs for a few hours and I'm very frustrated. I'm giving them answers that I think everyone should know. So if that heads forward, these muscles are going to fire off. So all of these people here are going to be diagnosed with tight shoulders. And what are they going to say? These muscles are so tight, I can't relax them or anything else. So you go to a doctor without assessing why the muscles are tight, like a forward head carriage or anything. You give a muscle relaxant. Now these muscles are not under conscious control. They're trying to correct this. If you relax them, which way does the head go? Further forward. So that's not smart. Now, here's the Journal of Spine. Muscle relaxants. Studies do not provide evidence for long-term use of muscle relaxants. Muscle relaxants demonstrate more central nervous system side effects compared with the placebo in nearly all trials. What about electric stim? These muscles are firing off. And again, is the doctor smarter than your own body or is your body smarter than the doctor? Okay, if these muscles are firing off, they're trying to correct the problem. What about electric stimming this? Interferential current, electric muscle stim, ultrasound, hot packs, cold packs. No eligible studies were found which debate these recommendations. No eligible studies, no eligible studies, no eligible studies. So what do you do with that? Well, this is an excellent exercise. Before you do this, this is one of the most straining exercises I ever give my patients. So we have to do x-rays, and look at it. Now, if you have an old fracture in the rib cage, okay, and this is going with doctors, you may be able to do this and it may provide great benefit, but you have to have a corrective chiropractor that's skilled in this. It can also cause great, great harm. So you take something about this diameter. What we used to do is we'd roll up towels really like firm with a bunch of rubber bands. I mean, you could almost hurt someone with this towel, rolled up firm. And you put it right in between your shoulder blades. And I have my model here who I adore. I mean, I'm protecting my team. The reason our arms are crossed is because I don't want to get any funky comments. Nobody messes with my girls, okay? So she's like this. And when you're going back, this opens up the chest. Now, breathing increases what's called intrathecal pressure, and that forces fluid in the joints. Some people will not be able to go back all the way. She happens to get regular chiropractic care, so she's ridiculously flexible. Okay, you might be just staying there with the head floating above in the air. It's okay. Do deep breathing. Deep breathing. Start off with 3-4 minutes. Okay, you may be able to get on this so you start breathing better and you're going to notice more and more and more flexibility. But again, before you do this exercise, you have to find the problem. This can strain cartilage. It can strain the intercostal junction. You've got bone that comes around on the side ribs, and the bone stops here, and it goes from here to the sternum in cartilage. So that's the costochondral junction. So this can cause intense pain if you got some problems like that. So know that this is a dangerous exercise, but it can also be great benefit. Get approval before you do it. Shoulder and wrist pain. Well, again, pain without identifying the problem is not good. Now, I know you have never heard of the Food and Drug Administration approving something and taking it off the market after it went into the public and caused so much damage. Oh, wait, I forgot. This happened in the past. Vioxx, approved 1999, taken off 2004. Okay, so it was on there for 5 years, made $2.9 billion, and killed more people than the Vietnam War. No, nobody was arrested for this or prosecuted because they do make, I mean, they're pretty much sponsoring of every TV program you have, along with our government, which is another TV program. So let's look at non-steroidal anti-inflammatories. What do you do for wrist and shoulder pain? You take an Advil, Motrin, or Aleve. However, that destroys the building block of cartilage and increases your risk of these different diseases. Cardiovascular problems, gastrointestinal bleeding, heart failure, allergic reactions, miscarriage, atrial fib, all from the over-the-counter medications. But wait a second, what's it for? Pain. Now, what is it doing? It's destroying the cartilage that protects the joints, that gives flexibility. So I'm not going to identify why you have wrist and shoulder pain. I'm just going to give you a medication that destroys the building blocks of cartilage so you can regenerate it. Tylenol. Nobody knows how it works because nobody does know how it works. Okay, it says clinical mechanism of action, clinical pharmacology, nobody knows. Dulled emotional response, asthma, epidermal necrosis, blood cancer, decreased cartilage production. Okay, now, when you have a shoulder, that's a problem. Most commonly, this bone is called the humerus. It is held in a socket by muscles called rotators. If any of those muscles are injured, and you're going to see 99% of the time, heads forward, off to the side. So that means the nerve supply and blood supply to the topmost muscle, it's called the supraspinatus, is the most commonly injured. And when you look at our shoulder health video, we detail out this in great ad nauseum detail. But if you compromise that nerve supply, the shoulder doesn't fall out, it falls up because you have this massive deltoid. So here you're strong as heck. When you go like that, that's when it malfunctions, okay? Now, what's really frustrating is people will go to certain medical professionals that are not aware that the neck is part of the problem. They're not aware that that labrum is distorted. They're not aware that it's superior displaced. And they'll try and run this shoulder through a full range of motion, and they'll be walking up a wall to try and stretch it. Well, it's not in the right place. It already has a distorted labrum. So if you're doing exercises without correcting the problem, and the problem over 90% of the time, it's secondary to a cervical problem, okay, you have to reform that. Does that make sense? Okay. Now, so until you find the problem, no full range of motion exercises. That just doesn't make sense. We got to reform that labrum. Ice on acute injuries is okay, but ice for chronic injuries doesn't make sense because if we're rushing blood to the area, because what is the most common injury of the shoulder? Head being forward. If your head's forward, you're choking off the blood supply and nerve supply to that shoulder. So if you put heat on it, you're going to rush blood supply to it. But correcting the cervical curve makes the most sense. So to correct the shoulder, you put your palm forward, it's going to pull that down in the socket, and you move it very little, very little. We're talking butt to belly, butt to belly. Okay, just like a pendulum. But you need a great weight. I mean, a guy with shoulders like mine, 15, 20 pounds is normal. Okay, standard girl, 10 pounds. Little kid, maybe 8 pounds. But you need enough weight to pull that shoulder down, and then you reform it. Now, do you want to do it like this? No, because most of the time there's a shoulder problem. Do you want to do it like this? That makes more sense, doesn't it? But while you're doing that rehab exercise, you're getting the curve back in the neck. Bursitis. Bursas surround tendons, okay, and they cushion that tendon because the tendons cross the joints. Now, if you have this olecranon bursa, see, it's filling up with fluid, right? So now, since fluid has to flow in, it's a superfiltrated blood that creates the bursa fluid, and then it has to drain because it's always being produced. If you have something that's filling up, is that a problem with blood flowing into it or blood draining? Draining. Again, we're just talking common sense, okay? So on this one, you would not want to use heat because it's already inflamed, it's swollen, but you would want to use counter pressure. So this is where you take a band, ACE bandage or something like that, and put a counter pressure in there, which is going to start to blow out the valves so the bursa sac can start draining. but this is most common in blood disorders like gout, okay, or blood toxicity and direct trauma. So really, and then again, there's going to be a cervical spine issue there. So looking for the cause of this, which is going to be toxic blood and forward head carriage, does that make sense? Yes, absolutely. So you have to fix the forward head carriage before you treat bursitis in the shoulder, elbow, or wrist. Carpal tunnel syndrome. You actually have a tunnel here. And when I was working with cadavers, I would open it up and open it up in a normal adult hand. You could actually sit a dime in there. It's that big around. It's about the size of a dime. Now you have muscles on one side, muscles on the other side. These are called flexors. These are called extensors. It should be a 5-to-4 strength ratio. Now what happens during the day, we're always grabbing stuff, right? So we're not making fishing nets anymore. So typically there's a muscle imbalance. Now, if there's a muscle imbalance, the flexors are stronger than the extensors, so we're putting a force loading on this, and that's going to flatten out the tunnel. Now, in Crazy World, see that white band of tissue? It's called a flexor retinaculum. It looks kind of like a tennis bracelet going around it. In Crazy World, we're not going to correct the muscle imbalance or correct the cervical spine problem because carpal tunnel is generally thought to be a double crush injury beginning in the neck leading to a muscle imbalance. They'll cut that to take the pressure off the median nerve without correcting the problem or correcting the muscle imbalance. I know that doesn't make sense, does it? But again, it's the most common sense thing in our country. Okay, so what we want to do, we want to strengthen the extensors. So how would you do that? Take a number 32 rubber band, and I say, make your hand like a flower bud, then turn it into a claw, flower bud to claw, flower bud to claw. And you do this to strengthen these muscles on the back half. Okay, and you do it to fatigue. And then what happens when you're done with it? You do it more because you're correcting a muscle imbalance. This is the key. Now, but wait, do you also need to correct the curve in the neck? Absolutely. Now, this also, let's say that your hand pain is waking you up at night. So a wrist brace, remember, you're talking muscle imbalance and a secondary injury from the neck. If you put a brace on there, are you making the muscle imbalance worse? Yeah, because you're not using it. So how about we give you a vital brace? You put your thumb and pinky together and you put a band of black tape around here. And I like electric tape because it doesn't stick to fur. Okay, and then you take that tape away and you'll be maintaining that tunnel. And you don't need to use the tape for a long time because by correcting the muscle imbalance and restoring the curve, you're talking about a week, week and a half, you're going to start to see a change in symptoms. So it happens quickly. Low back pain. When you have low back pain, what do you have to do first? Find the problem. Are you seeing a pattern here? Okay. I grew up with Doan's pills, okay? Yeah, take it in here, it goes right to that back, okay? No, it doesn't. It goes in your stomach, through your intestinal tract, through your liver, up to your heart, out to your lungs, back to your heart, and in the entire body. That's how all medications work. So first you have to find the problem. How do you find it? You got to do it with x-rays. You can't have somebody just say, wow, it's old age. Sorry, doesn't work that way, okay? I'm 61 now, and I guarantee I work as hard as two 30-and-a-half-year-olds. Seriously. I know it's not saying much. Most 30-year-olds don't work that hard today. Okay, surgery, the ultimate placebo. Hey, you got to read this book. It's like, oh my gosh. So now when patients come in, what do they do with chronic back pain? Do medications correct the problem? No, they just dull it. So if you're taking medications, we already know that that causes a host of injuries. And then you go to the surgeon. What is the surgeon going to suggest? Surgery. Oh, what a great idea. I didn't even think of that. Okay. There's little evidence that spinal fusion for surgery and back pain is effective. It's very expensive, tens of thousands of dollars per case. Now, again, this is out of the Journal of Spine. Although there are multiple surgical options for treatment of chronic low back pain, there is currently insufficient evidence which to draw any firm conclusions at the effectiveness of the outcome. No kidding. When you start to fuse areas, the area above and below got to move twice as much. And I've got to tell you, every time you see somebody with back pain, their body is like this. There's something, I mean, you can't think that the L5S1 disc or just that disc is the problem. If you look at the overall body, what if their body's forward or off to the side? You're talking about huge abnormal force loading. Is the pelvis stable? Do they have bunion formation? When they walk, is their gait off? And you're going to tell me that when this body, with its laterally deviated and all these forces, all these traumas in the past, you're going to fuse this one disc and it's all better? Nope, doesn't work that way. How about injecting it? Now, injecting a painful area with above the dura mater an epidural shot, okay, is anyone suffering from epidural deficiency syndrome? No? Okay, so let's see this. Infections contracted in hospitals are fourth largest killer in the United States. Okay, fourth largest killer. One out of every 20 hospitalized patients gets an infection. 103,000 die every year. And is anyone suffering from epidural deficiency? No. Failed back surgery syndrome. Now, it depends. When you talk to a surgeon, they'll say you got a 90% success rate, 95%. They're measuring it not on pain relief. They're measuring on knocking you out, completing the surgery, and waking you up. Okay? Fantastic. They're not measuring on long-term effects. It's so common that they developed a billing code for this, failed back surgery syndrome. And I think it's like 40 or 50% failure if one surgery. It's about 70 to 80%. If you have two segments, it's about 100% if you fuse three segments. And I got to tell you, in practice, if you're fusing the lumbar to the sacrum, you're creating an abnormal biomechanics that person will never recover from. I mean, we can stabilize the pelvis as much as we can. We can correct the thoracic areas as much as we can, but it is an abortion. And I mean, I know when surgery is necessary. We referred, I think, 4 or 5 people over the last 20 some years. So it is necessary sometime, but not like what they're doing. How do you find the problem? Look for a corrective chiropractor, and that is like finding hen's teeth. Since 86% of the schools are no longer teaching this, you got 7 questions to ask. Let's lower the bar further. All you got to do is get a yes to 5 of them. Do you take an x-ray? Yes, why not? You got to find out what the heck you're working on. Do you take a second x-ray to document the structural and neurologic changes that you've made? That kind of makes sense, wouldn't it? If you get your car fixed, do you drive it around the parking lot to make sure it's fixed? Yes? Yes. Okay. Do you get listings off of it? Do you work on post-surgery patients? Can you reverse arthritis? Because if you're correcting the biomechanics, you're going to see disc regenerate and bone spurs go away. I mean, we're just talking common sense here. This is one of the worst exercises you could possibly do. When you lay like this, you're actually reversing the disc, but it opens up the holes. They're called intervertebral foramen, where the nerves come out, and it feels amazing. But you're doing damage. And a lot of healthcare professionals are recommending this. It is the craziest thing in the world. Decompression kind of works sometimes. This inversion table, for a human being, it's fantastic. It lets lymph flow, it decompresses the joints, it's amazing. For the standard American, I wouldn't recommend it, because this inversion table, you're increasing the blood pressure in your brain. Now, Americans are poisoned and sick and drugged. Okay, so if you invert them, that is not good. If you're a healthy human being that takes no drugs, has a normal plant-based diet, and you're reasonably healthy, it could be really good for you. Okay, just talk to your healthcare professional before you choose this. Our decompression is not straight axial traction. We actually bend, turn, twist, do certain force loadings, because the spine's never straight. It's always going to be a little bit off to one side, so there's going to be compensatory changes. This is one of the best exercises that you can do. We use a 4-inch foam piece that's out of this world. Now, it's the bottom of the elbow is the bottom of the roll. And again, you've got to talk to your healthcare professional that's qualified that can actually correct the problem, not one that drugs the problem. Bottom of the elbow, bottom of the roll. 20 minutes in, 10 minutes out. 20 minutes in, 10 minutes out. That's what it is. Why 20 minutes? Because it takes 20 minutes or 18 minutes, a consistent force loading to cross that plastic elastic deformation curve that the body does under appropriate force loading. It's also placed at the junction of the rib cage and low back, so it's higher than a lumbar support. Now, let's say that you want to decompress this joint. Think of this. You're in a chair with arms and you push down. So your butt, are you decompressing the body? Yes, you are. Now also you're leaning back. So you're getting a force loading going from the back to the front to open up those discs. It's amazing. And then you're decompressing it. Now remember, discs get their nutrients through imbibition. And a disc is 70% fluid. So if you're able to do that, it's like putting a sponge in a sink. If you just drop a sponge in water, it'll eventually soak it up. But if you squeeze that sponge, does it soak it up quicker? Absolutely. Amazing. Now, again, you've got to talk to your doc before you do this. This one is really dangerous and really effective. This is a modified Cobra, okay, where you're going to do a pumping action. Now, if you do this 2 or 3 times and you notice there's an increase in pain, do not do it. Okay, do not do it. But if you do this, you want to, it's a modified Cobra, because full-on Cobra, your arms are stretched and you're bending out completely. This one, act like your belt is bolted down to the table, so you're just isolating the low back. Now that's going to create a negative pressure on the front portion of the disc and can start to rehab that very, very well. Also, when you have lumbar issues, the pelvis is going to be unstable. We recommend a trochanter support, which is fantastic. You can also sit backwards in a chair with your legs out like a cowgirl or cowboy. That'll get the legs out and approximate the pelvis and help. But know that when you're sitting in a chair, you're destabilizing the pelvis and you're flattening out the disc and increasing the pressure. So sitting is not healthy for you. Movement is fantastically good for you. Movement it allows fluid to go in there. And one of our patients with, just horrible, horrible disc and a neck issue, everything else. So I had him sit in a chair. He reached over, grabbed both of his hands on one leg, and used the strength of his arms to turn one side, and then grab the leg and turn the other side. This while he's sitting down, because that movement will start to fill it up with fluid. Okay, and it's movement that gets fluid back into that. So, but again, the movements have to be consistent with what's going on with the body. If you have a herniated disc and you haven't decompressed it, if you still have the muscle spasms on either side, if you're not correcting the other aspects of the body, the movement might not be good. So you've got to talk to a qualified doctor, not one that's going to drug symptoms, but one that can identify the problem and fix it. Knee pain. I forgot to put that one thing on here. So what's the first thing you got to do if you have knee pain? Find the problem. Okay? Good. I think my work is almost done. So the knee joint is only going to give you symptoms for a reason. It's an alarm. Now the knee joints are hydraulic, and you've got a pump in the back of the leg called the soleus. So if you have compromised nerve supply to the foot, say the foot is flattening out, you have bunion formation, that's going to cause your gait to be off, and that's going to cause the soleus pump to not work right, and the knee joint will start desiccating or drying up. How do you know? When you're going from sitting to standing, if you hear, okay, that means there's not a fluid in the joint. Okay, so what we're going to do is distract the joint, but this is just the smallest. And this is a 10-pound weight on this gal's legs. You don't want to lift them up. You're not going to lift your legs up. You're just going to dangle it because it's a ligamentous-based exercise. Now, if you've had multiple surgeries, if you've had, cadaver ligaments put in there, this might not be the best for you, but you need to have a qualified doctor tell you, yes, it's good for you, or no, it's not. But distracting that joint, if you got normal ligaments. even damaged ligaments. You're going to strain it. You're going to cause inflammation. And that's how the body regenerates. It's amazing. But should you fix the original problem, like restoring the nerve supply, blood supply, getting the calf to work correctly? All of that's important. Absolutely. And you can see meniscus can be regenerated. But you are never, ever, ever, ever going to have a one knee problem. You're going to have a one knee symptom, not a one knee problem. And you have to look at the secondary or the primary cause of that knee issue. They're going to be unstable pelvis, because if you're walking on an unstable knee, you're going to have an altered gait. You're going to have disc injuries in the low back. You're going to have altered foot. So it's a knee symptom from a body problem. It's called finding the problem. Does that make sense? Now, vastus lateralis and vastus medialis, okay, there's a way to check patellar tracking, and we cover this in detail. But think of this. You've got the quadriceps that are nervated by nerves coming out of the low back. So could you have low back pain telling you that that quadricep is not firing correctly? Absolutely. And this is an asymmetrical exercise that if you're restoring the nerve supply to the quadriceps, you only got to do for a couple of weeks, tops. And then you're going to correct that muscle imbalance. But you've got to find the problem and correct it. You've got the hydraulic joint, the knee, and you've got a pump on the back of the leg. This is why we give this block of wood to restore normal flexion of the foot. And it's called dorsiflexion, it going up. Okay, so that gives a better movement of that pump. And then that fills the knee up with fluid. It's fantastic. And I love this. The Journal of Spine, 2003. Turned out that a chiropractic adjustment was better than Vioxx. Of course, they had to stop this article because Vioxx was pulled from the market. Inflammation is how the body heals itself. Inflammation is how the body heals itself. I just showed you how you inflame the joint by putting a weight on it. But think of that. Inflammation is going to create free radicals. So antioxidants like vitamin C, omega-3s, plants, deactivate those free radicals, so it makes inflammation effective at regenerating tissue. And you can look at our videos on inflammation. It's very, very clear. So if you take an anti-inflammatory, like a non-steroidal anti-inflammatory, we know, I just showed you all the damage those do, because they stop the chemical process of inflammation. That's a healing process. And I even had this doc come in with her patient, and she was giving her non-steroidal anti-inflammatories. And I said, the patient's saying, well, I take it for inflammation. And I said, is inflammation a healing process, doctor? And she says, yes, it is. Okay? I didn't put her on the spot and say, well, why are you giving this girl something to stop the healing of her body? Because that's their protocol. The protocol is ridiculous. Anti-inflammatories. These are all plant products. They work, okay? Omega-3s, green vegetable juice, plants. That's why when somebody is getting adjusted, we give them a nutrition report and we talk about vitamin C, omega-3s, plant-based diet. I mean, it works excellent. Cayenne pepper helps headaches. Why? Because cayenne pepper is loaded with vitamin C, which is an antioxidant. It's also a massive vasodilator. And since most headaches come from the neck, do you think if the head is off to the side, do you think I have good blood flow or poor blood flow? So if you take a cayenne supplement that can vasodilate, do you think that helps blood flow? Oh my gosh, that makes sense. But it's not cayenne deficiency syndrome. It's going to be a problem. Water. Amazing pain reliever. Okay, 50% of your body weight in ounces a day would be good. So the average person, 1 to 2 to 3 liters a day is fantastic. If your urine is light yellow, it's perfect. Okay, if you're drinking a lot of water and you're sweating it out, put a little bit of minerals in there so you can get absorption. Fish oils, fantastic. And here's a bunch of other things, but all of these are herbs. I don't want you to do the anti-inflammatories because nobody is suffering from a lack of primrose oil. Nobody is suffering a lack of cayenne cream. Nobody is suffering from a lack of ginger, okay? You can suffer from a lack of garlic, because who loves garlic? There you go, baby. So find the problem first. Okay, does that make sense? Organic, healthy diet. I mean, it just makes sense. What I want you to do is not treat the symptom with an herb. I don't want you to treat the symptom with the pain with Botswana or any of the antioxidants that we got. You got to find the problem first. Does that make sense? Okay, now the censorship is getting, I mean, just look at Dr. Joseph Mercola and what he's going through. Okay, so this is the end of our, what I think will be approved, okay, currently in our environment. In a month, this probably won't be improved, okay, but currently I think it'll get by the censors. The next part definitely will not be approved. So if you're watching the Dr. B VIP stuff, you will see this uninterrupted. If you're on YouTube, I got to say, God bless you. Thank you for supporting us. Follow, give this advice to your healthcare professional. If they're not looking for the cause of the problem, have them call me or find another healthcare professional. If you have somebody that's just treating symptoms, even if they're treating it with ultrasound or electric stim and they're not looking at the cause of the problem, and let me tell you, tight muscles, why is the muscle tight? Ask that question, because if you're getting a massage every day, which feels great, okay, if it's going after the source of the problem, it's wonderfully good for you. If it's just there for therapeutic or for comfort, it might not be the most effective use of your time and money. Okay?